Hello everyone, I'm Dr. Clinton Orsini with Connect 33 Upper Cervical Chiropractic. Today we'll be covering our basic cervical subluxation analysis. In this video you're going to get to see the lateral cervical pathology analysis, what we see in the motion analysis as far as the stress films of flexion and extension, and you'll also get to see our alignment films, which is composed of the vertex taken from the top and the nasum shot straight on from the front. Let's go right into it, folks. So, here we are looking at the lateral cervical x-ray on this patient. This is going to be our basic analysis. We start with the lateral cervical x-ray to look for any basic pathology. So first, let's get situated. This is the head as a whole. This is the skull. This is where your brain sits. This is your eye right here, both eyes technically. Your nose is right here where the cursor is. If I lighten this up, you can see the nose right there. I'm going to keep it dark for right now. This is your mouth. We got some fillings in on this patient. This is the atlas, this vertebrae right here. This is the atlas, the first bone of your neck where the skull is sitting and resting on top of. This is the bottom of the mastoid, which is a little part of your temporal bone on the side of your head that I need to mark. And this is the bottom of the patient's earlobe as well. So I got a little marker for both of these, and we'll talk about that in future videos. This is the second vertebrae, the axis. And then we start to go into the normal cervical vertebrae, the third, fourth, fifth, sixth, seventh cervical vertebrae. This is the hyoid, the floating bone. We can see where the tube, which goes down into your mouth and lungs. We won't talk about any of that. But what we are going to mention is some clamping that we see on the back side of these vertebrae. These vertebrae are supposed to be nice and open like what we see here. If I zoom in, we can see a nice fat disc spacing in between the vertebrae. If we come in over here, though, we can see that clamping, that spacing is clamped down on this backside. So we are going to keep note of that as we move forward. So our next picture is a flexion film. When a patient flexes down, the spine should be a nice rolling curve, should make an inverse curvature, and all these little tails, what we call spinous processes, should flare open nice and evenly. In fact, the most amount of motion should occur right here at C5 and C6. Unfortunately, what we see here is C2, 3, 4, 5. C5 is super stuck to C6. That is our primary issue. In this patient, they are having numbness and tingling, weakness into their fingers, their hands on both sides. This patient needs to use their hands for their job, so that's why they came to me. And the nerves that exit out of the mid-neck are directly what relate to the hands. And so that was another key point, was that we knew exactly what symptom they were dealing with. So we knew where to kind of cheat and look at the area of the spine, but very clear cut, C5 not moving off of C6 whatsoever. We'll talk about in future videos how you fix that. When we take the spine backwards, we're looking for the spine to make a nice rolling C-shaped curve, and all these little tails, the spinous processes, should close together, just like what you see right here in the middle right here. All these bones are closing together. However, right here, the C3 vertebrae, it's not coming down onto C4, so that's another issue right here. If we darken the film, we can see C7 not closing on T1, T1 not closing on T2. So we also know that those are other extension type issues. I'm going to show you with the marker, but we can see T1 and T2 need adjusting. Also C3 needs adjusting. So kind of cheating when I know all this. This is lastly the vertex, not lastly, second to last, the vertex film. Vertex film is where we take a picture right from the very top of the patient, looking straight down onto all the structure. So again, left side of the film right here, right side on this side. There's your two eyes. The nose is right here. Nose is moving along the center point of the film. These little nails are not in the patient, in case you were wondering. They've been on all of our films. They actually just show us the center line of the x-ray. You can see what the vertical and the horizontal axes and where they fall onto the patient to make sure this film is proper. We do have the horizontal and vertical right here. We're also making sure the atlas falls right in the middle of this film. We can see that the atlas has rotated forward on the right side or backwards on the left. I'll show my markers right here, and we can see on this patient it's moved backwards on the left side 2.5 degrees on this left side. So again, we'll talk about in future videos how we adjust this, but for right now we're just showing you the basic analysis. Lastly is the most complicated film. We'll create a whole video just on this x-ray alone, but this is called the nasum. This is a picture taken from the straight forward on the patient. We take it at the level or line of the atlas. So in fact, this x-ray is not taking it 90 degrees straight on. It's taking slightly from S to I or slightly downward along the angle of the atlas. So this x-ray is actually taken along this angle right along here. That's how we take this x-ray.
right here. And then this is the projection that you see. Left side, right, there's your eyes. This little bow tie structure right here, that's the atlas we're looking right at. And then here's the rest of the vertebrae coming down from left to right, and then more rotation coming down here on the lower part of the spine. We'll cover again this in a future video, should I say. But the key takeaways from this is that the atlas has risen up on the left side, creating an opposite angle. The acute angles on this is on the left on the top side and on the right on the bottom side. So if you remember your physics and levers and wedges from physics when you took it in high school or college, you have to come high above this angulation to drive the structures across. And again, we'll cover that in a future video. But this does give us our basic analysis to figure out how high and how rotated we have to come with our adjustment vector. So if you like this video, I would please ask that you press the like button, and if you want to see more content like this in the future, please press the subscribe button. I'm going to start to upload videos onto this YouTube channel. And until next time, you have a great day.